Hello, everyone. I see that 5 people have joined already. So we're going to go ahead and get started. And anyone who jumps in later, we will hopefully be explaining everything clear enough that they can catch up with us. Okay, so I'm Nikki. I'm here from ChartFlow today, and I'll be doing a webinar on how to use an EHR, an electronic health record system, with your medication aid program. So don't worry if you have a medication tech program or a medication assistant program, anything where you're actually doing skills or simulations or any type of classroom hands-on activity involving medication administration will be relevant to this webinar. I'm going to be giving you some free teaching ideas, and afterwards we'll make sure that we send some lesson plans that you can actually use. Today we'll be talking about 2 specific lesson plan ideas that you can do in your classroom or in a skills lab. If you have questions throughout, there should be a chat that you can use. If you do not see that, that's okay. Afterwards, I will do my best to open it up to answer any questions that you have. Today, we will be using ChartFlow, which is just the company I work for, but that doesn't mean you have to use ChartFlow. Any EHR or charting system you can use with these lesson plans. So this isn't just one big sales pitch. You can go ahead and steal my ideas and use them with whatever you have. Okay, so the first lesson plan we're going to be talking about today is a very simple vital signs activity. And I know that's not the meat of what you do, but it'll give me a chance to show you how to actually incorporate a chart. Then we're going to jump into the meat and potatoes of medication aid or medication assistant programs. And we'll actually talk about how to use the charting system with a medication administration activity with an oral tablet. So first things first, let me go ahead and share my screen with you all. And on here, we're going to see a list of activities. So we're going to be talking about the vital signs activity first. And I'm going to go ahead and open that up. What I like to do with this activity is I like to do this as just an in-classroom activity, and we split our students up into pairs. That's a really good way that everybody can be working on it at the same time, and you don't spend too much time on this activity. So usually it could take an hour to an hour and a half. If you have electronic blood pressure cuff, then it could be as short as 30 minutes. Once you have your patients divided up into groups of 2, we're going to make sure that we introduce the activity. So the only equipment you'll need for this activity is to make sure that everyone has access to a blood pressure cuff, that they have access to a thermometer and disposable tips for it. And if you're using a manual blood pressure cuff, you're going to want to make sure they also have stethoscopes. And it's okay if you're a low budget operation. We have a background in career in tech, so I'm very used to working with schools that have no money to buy more materials. So if you have one set of items and your students are sharing that, that's okay. They can rotate it between them. One person does their heart rate while the other group is doing the blood pressure, and they're going to go ahead and rotate the materials. But once you divide everyone up, we're going to introduce this activity. So we're going to tell the students that today we're going to be practicing vital signs. I want you to open up the patient chart, and this can be done on any mobile device. Even if you do not have computers in your classroom, everyone has a phone in their pocket. So they can pull out their phone, they can use a tablet, they can use a computer, it does not matter. They're going to log in, and just like I opened up this patient, they can open up Edna Jones. If you are using ChartFlow, this is one of our template patients, but she would be very easy to replicate in a different system. She's a very basic patient. She's 79 years old and living in long-term care. So we're going to tell our students, open up Edna Jones, and we're going to have one of you pretend to be the resident Edna, and one of you are going to pretend to be the medication aide. And the person who is pretending to be the medication aide needs to come into the orders section to see what we need to do today. On the left-hand side of the screen, you will find a button that says orders. This is where medications live, but it's also where non-medication orders live. So we have vital signs here. I like to use a pre-built patient instead of a blank patient because I think this is a very good way to introduce to students both their scope of practice. We're not just doing things willy-nilly. We're doing what we're asked to do. So this patient has an order for vital signs. It tells us exactly what vital signs we need to take. We do not, for whatever reason, need to be taking this patient's oxygen reading. We are just going to do blood pressure, heart rate, respiration rate, and temperature today. So we have the order there. It's a good way to just talk about what their roles and responsibilities are. Go ahead and tell them that once you see the orders and you decide what vital signs you need to take, that they are going to go to the vital signs flow sheet, which is just the part of the chart that has vital signs in it. And they are going to take their partner's vital signs. So that's the part they're going to be doing in real life. So they'll take their supplies, and you can see that when we do a new entry, there's going to be fields to record that information. So they can go through, they take the temperature, they take the heart rate. While they're doing this as an instructor, this is your time to be walking around the room and helping them. So let's say they're doing the temperature. I'm just going to put the same thing we had before, just as an easy example. But you want to make sure that they have that disposable tip on the thermometer. When they get to the heart rate, we are going to make sure that they're doing it correctly. So did they count it correctly? If they're having a hard time finding a pulse, that would be your cue to help them and show them where to find that. Are they using their thumb or are they using their fingers to find it? When they do it, if they can't find it, make sure they're not pressing too hard. That's a really common problem. If you press too hard, you won't be able to feel that pulse. So they're going to go ahead and put in their heart rate. I'm going to go ahead and just copy it down, make it normal for this patient. We don't have a pulse ox, so we're not putting in the pulse ox. Again, this is another way that they can become acquainted with only doing what they're supposed to do. In this case, we're not required to do the pulse ox. We shouldn't be charting in a part of the chart that we aren't working with at this time. Respirations, they'll go ahead and put that in as well. One thing that I find is if someone's having a hard time counting respirations, you can coach them to ask first, and if they get permission, to place their hand on the resident's back or the student who is pretending to be the resident and feel for those respirations. That can help. And the blood pressure, we're going to go ahead and put that in here. Let's say we have a 118 over 80. Oh, 118 over 80. And we're going to record where we took that blood pressure. And usually if you're using a manual blood pressure cuff, this is the part where you'll have to do the most coaching. Once they fill that out, they're going to have a save button at the bottom, and they can save that information. Once they hit the save button, it's just like a real EHR, and any academic system will behave the same way. Once you save it, it's in here. It's not going to get lost. You can review it as an instructor, but also when we're done with this activity, you can review it as a group. At this point, once you notice that the first student is starting to finish their work, go ahead and tell your class to switch partners. So make sure that second person now gets a chance to play the role of a medication aide, and that their partner is now going to be Edna Jones. They'll go through and do the same thing, hit save, and once everyone is done, now is the point that we can use this for discussion. So one great thing about charting information during a lab and not just doing the lab and moving on is that now you have a reference point where you can do a discussion, or if you're used to simulation, you may call it a debrief. I like to call them discussion questions because usually at the medication aid level, we may just be sitting in a classroom doing these activities. So for vital signs, a good example of this, maybe you want to pop up one of these charts on your projector or your whiteboard. Maybe you just want to have students refer to their own work. But one good thing to ask in here would be, when do we tell a nurse about vital signs? They should be aware that if it's outside of the normal range, they notify a nurse. That would be a good point to ask a follow-up question. What is normal? What is the normal temperature you're looking for? The normal heart rate, the normal respiration rate. Once they answer those questions and you have a good review, you can always ask them for more understanding. When else would something alert a nurse? When else should you alert a nurse? Not just the textbook normal, but what else are we looking for? Hopefully, your students would recognize when you're looking at this chart, and this is one of the great things about using a pre-built patient in a chart where there's already some charting in here, we can see that this patient's blood pressure is very consistent, 136 over 85, 135 over 85. If you wanted to, you could put even more results in here. But then we have a reading of 118 over 80. For me, that might be normal. For this patient, that is not normal. So this is a good way to talk about normal is not just the textbook normal. Normal is also the patient's normal. So this is still a point where we want to tell a nurse or a supervisor that we have something outside of the norm for this patient. And that's just a good check for both scope of practice and also understanding when you need to be concerned about something. Okay, so let's go ahead and move on from that. Oh, sorry, 1 second. We're just going to make this small for a second and return to the activity. Now, the part that you all came for, which is talking about how to use a chart, an electronic charting system for medication administration. We're going to do an easy one, but you could make this more difficult. We're just going to do an oral tablet. So same thing, we're going to click into the activity. And this activity or any type of medication administration activity is going to have a little bit more setup. So before we even open this chart, we need to make sure that we have the medication. So in this case, it's going to be ibuprofen, 800 milligrams. We suggest using Walker Meds just because we have a partnership with them. We can give you a 10% off code if you're one of our customers, but you don't need to do that. You can use an old pill container that you've washed out and paste a new label on it with the information that you want. So that Frank Washington has a prescription for ibuprofen. It's coming in 800 milligram tablets. He's taking it every 6 hours. All the information that your students are expecting to see on a medication label. We have those that you can print out if you're using our site. You can also make them yourselves. If you do a quick Google search, websites like Etsy have some people on them who will actually make fake labels for you that you can use in simulation. So you have a lot of different options, but you do need to make sure you have your medication. If you're making your own, go ahead and fill it up with Tic Tacs. If you're using Walker, it has a simulated medication in it that you don't want to consume, but it's going to look like the real thing. You also need to have some sort of storage place. So whether you have a real medication cart, they go for about $150 if you get a very, very, very cheap one on Amazon. You could also use just a craft container with a lot of little drawers. Whatever your school is using to store your medications in, you'll have that. And then you want to designate a space for your patient. So Frank Washington, he might be a student that we've gotten to volunteer. He might be a random volunteer. He might be another teacher from your school. Whoever is playing Frank Washington will be set up in a specific part of the room, and you want to designate that part of the room as his room in a residential facility. So we can put a piece of tape on the floor. You can put a desk next to him, anything that can indicate this is where his room starts, and you'll see why that's relevant. Same thing as before. Whenever you're starting a lab, you need to introduce the lab. So if you're using a chart, part of that is going to be setting up your patient. So we have Frank Washington in here. You can already see him. We already have the activity with all the orders on it. If you're using our site, you can go ahead and use this pre-built activity. You will tell the student, okay, we're going to do a simulated medication administration of an oral med today. You're going to go over to where we store the medications, make sure they're familiar with your school setup. Once you get there, I want you to open the patient's chart. You can tell them if they're going to do this on their phone or if you have computers in your lab that they use or tablets, whatever the case may be. Let them know how they're going to open the patient chart. You're going to look at the orders, determine what medications you need to give to Frank today. You're going to prepare those medications and follow all of the steps for administering them correctly. When you are ready, the patient is sitting over there. Make sure you tell them where the patient is sitting and where their room starts. And then go ahead and tell them to get started. So they'll come over to where your patient or where your medications are stored, sorry. And they will come in, they'll open the chart. the first thing they want to do is go to either the order section, which you've already seen, so we're not going to use that one again, or the MAR. And this is a medication administration record. This is the same thing all of you have seen before. Even if you have never used an EHR in your life and you've only used paper charting, this is the same exact thing as the medication administration record, or the MAR, that you used on a paper chart. It is literally a schedule with all of your medication orders on it, where you can record what has been given or will be given. All of that information is on this timetable. So we can see the order is here. And this is important because your student, before they take out that medication or open up that drawer that your medications are stored in, they need to know what it is they're looking for. They need to know what this medication is. They need to know generally what the medication is for. And most medication aid curriculums have a suggestion that the student knows what side effects to expect, what the desired effect is, anything else that they need to know, they should know before removing the medication. So that's all information that they can get from both their previous study and the order that is showing up on the MAR. So they take their information here. When we talk about using a chart in a simulation or a skills lab, we're talking about using a patient. Your chart is your patient. You don't have to have a volunteer memorize a patient scenario because they don't need to know all this information anymore. It's in the computer already. So your students will see this. We need to go ahead and take out the ibuprofen. So they're going to remove the ibuprofen. In this case, it's going to be in a pill bottle. They're going to remove it from storage. They're going to check all of the information on the label against that medication or against the order. So we do our 3 checks of the medication information compared to the order. We're always going to do that when we take it out as our first one. You want to make sure that they're always keeping in mind those rights of medication administration. So we're monitoring for that as they do this lab. So they take it out. They're going to open up the pill container. They're going to dump out 1 pill because we can see the dose is 800 milligrams. This is also administered or provided in 800 milligram tablets. So they only need 1. So there's no extra math to do in this case. They dump out 1 pill into the cap, pour that cap into a medicine cup. Most facilities suggest putting the name of the patient and the name of the medication on that medicine cup. You don't have to do that if you don't do that normally. It's completely up to your region and how you handle medications, but that's a pretty standard one that I've heard a lot of schools talk about. So if you do that, have your students record the name of the medication and the patient. They should check the order against the bottle again as they're preparing it. And before they put that bottle away, they need to do the 3rd check to make sure that everything matches because we don't want any medication errors. Okay. Once they have prepared their medication, before taking it to the patient, we recognize that this is an oral pill. Medication that's taken orally typically needs water. We don't see any other notes here about water or restrictions or food. So make sure that they prepare a standard cup of water and then they take this to your patient. This is the part where it becomes important that you have a designated space for your patient because in every medication aid program I've seen, there's always a reference to respecting patient autonomy and privacy in a residential facility. So as they come in, they should knock or pretend to knock. Mr. Washington, can I enter? Once they enter the room, they should introduce themselves. They should also explain the purpose of their visit. I'm bringing you your medication today, your ibuprofen that you take for pain. So they have all that information here. We can see that it's 6 o'clock on our simulation time, 6:06, because I've been talking for 6 minutes already. And we can see at 6 o'clock, this medication is due. So when they give the medication, once they introduce themselves, they give the medication, they make sure the patient has water, they make sure the patient is sitting up. Once the patient takes the medication, so if you're using candies or Tic Tacs or mints, Maybe you've already agreed that they will actually consume the medication. If you're using a Walker or other simulated medication, the patient will not actually consume it. The patient actor, the friend or teacher or whoever it is, will just say, I've now swallowed the medication. You need to make sure that that student is paying attention, that they stayed until the entire medication was swallowed. They make sure that there's no adverse reactions. When they come in here, where it says due, all they need to do is click on this and they can go ahead and fill out that information. So when I click given, this is going to pop up. And this is the same as doing a paper chart. So they're going to go ahead and fill in the information. It was given an oral medication, and you have a free form text box here. And that is where you can put in any notes. If the patient didn't want to take any water today, we could say swallowed pill dry. If the patient refused the medication, this is where you would put more notes in before notifying the RN. This would be where you can put all that extra information that they need to write down. They're going to hit OK, and we can see that it's given. You as a instructor, or if the student were to open this chart back up, they will always be able to see that information now. Again, it doesn't go anywhere. So we have given the medication, and once the lab is done, this will be finished, but the lab is still the charting is still accessible to you. What's really important about that is the same thing I said before. Discussion and debrief is very important with these activities. So in this case, this is both a discussion point, but it's also your log that you did this lab time. So it's a record that the student did this activity. You can use that for grading. You can grade this on your side, or you can use that to just maintain records if you need to show lab hours at the end of the program. Okay, so one thing that I would say with this one, with a debrief question, some good questions to bring in would be asking generalized questions about the medication to make sure they did have that information in the beginning. Hey, what medication did you give today? Ibuprofen. Can you tell me what that's used for? What are some negative side effects that we might see? You can ask those questions to check their knowledge here. If they did have any mistakes or mishaps, during the debrief or the discussion would be your chance to ask about those. Why did you do that? What should we always do before we enter a resident's room? Any of those questions to make sure that they do it correctly the next time. All of that the chart can be a jumping off point for all of that. So it's your way to start the conversation. Okay, so in here, we talked about our vital signs activity. That was in the vital signs section. We talked about the importance of orders and that we can put both medication and non-medication orders in here, which is great practice for students looking up their own information and determining what they are responsible for and what falls within their scope of practice. We also talked about the MAR, which will be on every EHR. It's just your medication administration records. You'll also see your orders in here, but only the medication ones typically. This is also where they can say if a medication was given, held, or refused. So all that information is going to be right on this site. Okay, I think that covers most of it for our very simple teaching ideas for today. Let's see, I'm going to open it up and see if I had any chats on here. If anyone has any questions, you can go ahead and post them on the chat. Oops. Let me make sure the chat is open. Okay. And it should be open. I don't see any questions on here. What I will do, if there aren't any questions, what I will do is this recording will be up afterwards. We'll make sure to share this recording with everyone so that you can share it with your team or any other instructors that you might know. We will also include links to the 2 lesson plans that I talked about. You will have, if you do happen to use ChartFlow, you'll have all the extra activities as templates as well in our site. And if you're interested in using ChartFlow, you can always email us for more information. But again, you can use these activities with any EHR that's out there. Okay, I think that's everything for today. I'm going to stop sharing my screen And unless I see any questions, which I do not, I will go ahead and end the session. Thank you so much for joining. It was great having all of you. I hope you have a good day.